So today I have 2 stars, not only in UK, in the world. 2 stars, two of the most amazing injectors in the world. I'm so proud to have you at DAO, both of you. It's such an incredible, and by the way, totally spontaneous.
Yeah.
That Yussra happens to be in town during the same time that you have your masterclass in DAO Academy, and it's just amazing and epic that I can have you both and pick your brains and have questions raised by a lot of patients on our page for you to answer in the most scientific and top-notch way ever.
Honored to be here.
Welcome.
Thank you for
So
having
happy.
Thanks for having us.
I'm so happy to have
It's amazing to be in the presence of you two superstars.
Equally back at you.
I am so honored to be in the middle of 2 stars who shape the field in all ways. Dr. Zack Ali, you are a pioneer. My relationship with you goes way back to when I first opened my clinic back in 2019, when I got in touch with you because I did my research and I knew that you are the top trainer, one of the top trainers in the world. I did my research and I contacted you, and that's where I started sending all my doctors at DAO to be trained by you, and you really transformed their aesthetic approach and technique to injectables after coming back from your masterclass. The way you see correction using fillers and how you chase the light and the reflection to ensure that the face doesn't have any hills and valleys and it's just smoothened out in the most beautiful and sculpted way, where the fillers don't show that it's been injected, but rather integrated in a very natural and delicate and intricate way that honestly has to do, as Mother always says about your work, has to do with your artistic and incredible golden hands. I want to ask you, what has shaped, what was the most profound incidents in your life that has shaped your vision in aesthetic and in aesthetic medicine, and that has pushed you to become an aesthetic doctor and not a sculptor, because you're also a sculptor?
I do like to sculpt. I've been sculpting for many years, and it's very much transferable to aesthetics. But how I got into aesthetics is different, because when I first started doing aesthetics, I was a junior doctor, like many of us in the UK. We're overworked, underpaid, no flexibility, no autonomy. You don't have control of your life. So I saw the route for aesthetics to actually open that field. You can work when you like, where you like. You have the flexibility, the autonomy. You have a field which is untouched, high demand but low quality, no structure. So there was lots of room for innovation. So I started by creating a curriculum actually to teach people. And actually you learn by teaching. By teaching people, you learn the skill of how to inject. You become better at sort of appreciating the face. Put that with artistic touch, you can then create a concept, which is what I did at the time. And then we created a curriculum, and the curriculum led the path to sort of, an evolution from basic to very much high level, which is what I'm doing tomorrow at the masterclass.
Exactly, and you've really, you really did revolutionize the field with the academy that you've founded, that has spread across the globe, in America, in the UK, and in Dubai even. And it's become one of the official institutions and academies that accredits doctors in many countries, including Qatar, for example. The Ministry of Health just released that one of the boards, or one of the certifications that are accepted by the Ministry of Health there for being an aesthetic practitioner, is your academy. And it was such an honor to see your name there, to see the brand that you've created, you founded with your work, with your dedication to delivering the best knowledge and best training program for doctors to ensure that they optimize their technique after attending your master classes. That was wonderful. So now let's dive deep into the issue of dermal fillers, and it's become very controversial, especially in this time we're in. A lot of people fear fillers now. We see a lot of actresses and celebrities on TV with overly done faces, with misplaced filler. It's very obvious on camera, of course, and it has scared off a lot of people from dermal fillers. I want to know your take on it, and your take on it, please, Dr. Zack.
we have an issue right now where there's terrible publicity with fillers. I mean, manufacturers are selling less products. There's terrible social media influence. You see celebrities overfilled. And actually what you hear about is all the things that go wrong. So migration, puffing, Tyndall effects, lymphatic swelling, all the things that go, you don't really hear what goes right. So, and the issue we have really is as this industry grows and grows year on year, more and more people are entering the industry. And what tends to happen is it saturates the industry. So people stop saying no. People start to come in, there's no holistic assessment. It's more like, I want this. Okay, go ahead, let's do that. So we see an issue where people are not saying no, and as a result are overfilled. So I think fillers shouldn't be there to fill, but to balance. An artistic touch means filling what's needed, not what's wanted. And that's where that divide exists between needs and wants, something I like to teach in my practice. I think with time, this element of scientific artistry, knowing exactly how to approach a face, can be taught, but over the years needs to be adapted, which is my aim for the next sort of 5 or so years in the industry.
You're amazing. What about you, my dear Dr. Yussra?
I mean, so well said. I do think it's a problem. And like we spoke about earlier, I think bad news makes news. And there's billions of procedures being done worldwide. Unfortunately, the bad press overtakes all of the good undetectable work that people are having. So fillers are not the culprits. That's not the devil. It's the person holding the tool. And fillers have to be used selectively, judiciously, and used as a tool to address volume loss or structural deficits. And that's it. Unfortunately, what's happening is, as Zack so well said, people are injecting faces as though they're isolated features and not performing a full holistic assessment of the face. And then you see lips walking in before the rest of the face, inappropriate use of fillers in the mid-face or tear trough resulting in puffiness. And we see this in all calibers of people. And now the fear is that that's because of fillers and fillers are bad. No, fillers have been around for 25 years. They've been used safely for decades. They have a very high safety profile, a very low risk profile if used correctly, if injected in the right tissue plane. So this comes down to appropriate training, understanding facial anatomy, and having the ethical and professional integrity of saying no when it's inappropriate or unnecessary. And I think, unfortunately, social media is like a double-edged sword, right? We're living in this era of social media where the influence and the sphere of influence for us and for our patients is TikTok, Instagram, and all these other social media networks. And what they see on there, they think is gospel. And right now, there is misinformation about fillers where people are propagating that fillers are bad. And I actually reject that. It's not the fillers. I do think it's the artist or the lack of artistry behind the use of the fillers. And I think this was propagated by an MRI that, as you know, went viral recently. You've seen this MRI as well. And I think the story around that was wrong. And you know this story. This is a patient who is a celebrity who came to see me, who had Tyndall effect. She had tear trough filler that was sitting in the superficial plane, creating darkness or a blue tinge in her skin. And she asked me for more filler to correct that. And I said, no, I can't put filler in because more doesn't equal more. But in her mind, she had adapted to that effect because she had it 8 years ago with another practitioner. And in her mind, she totally didn't have it. So we kind of went back and forth. I did an ultrasound. I showed her this, but an ultrasound is black and white image. You know, for patients, it's 50 shades of gray. She didn't know what it was. So eventually we did an MRI and she could see categorically the position of the filler, and believe me that there was filler there. When I dissolved it, I referred to someone in America, and that MRI was released and it went viral with the incorrect clinical information behind it. And that alone, just that 30-second video on that MRI has had over 90 million views and has created huge, immense fear-mongering that is incorrect. It's, you know, it's not rightly placed. So yes, there are social media influencers propagating this message, but medical professionals, Zack, myself, and other people who are in a position where we are treating patients on a regular basis, utilizing injectables correctly, judiciously, carefully, and you know, undetectable work is the good thing is that if you do filler and people say you look good, but not, hey, who's your doctor? Then you know you've done a good job, right? There's a lot of that going around, but that doesn't hit the news. So we, I think, need to push back on this message and educate our patients that that's just not the truth.
Exactly, because a lot of people think I don't like fillers because I always talk about the misuse of fillers. But I use fillers. My mother uses fillers with you. And I always say fillers is a tool to be used wisely and not to be abused.
Yeah.
And that's why I always seek the best trainers for my doctors, which are both of you. I'm so happy that you're both here with me to really help clarify this point. Now, speaking about fillers, I want to talk to you about under eye fillers because you both mentioned Tyndall effect, compromised lymphatic drainage, and swelling and puffiness around the eye area. And fillers, dermal fillers, when placed in the under eye area, tend to have a much bigger risk than their satisfactory rate, especially over the long run. And as you said, your patient had injected under eye fillers 8 years back, and still the fillers were there, because a lot of the times I have patients coming in, I see the fillers in their lips, I see the fillers under their eye, I see it, but they are not aware, or they don't want to they can't believe that that filler still resides in their anatomy because they had injected it years back. So I want to know your say on the longevity of dermal fillers from your clinical experience, as well as its use in the under eye area for practitioners and for patients to know and be aware of. Is it a high risk? Is it something that they should avoid unless they are 100% sure they need it by like the right doctor, if they have like real fat loss? Or what is your take on it? Please tell me.
It's a good question. I think that's one of the things we see on social media a lot, where people are always talking about migration and swelling and Tyndalls around the eye. Me personally, I don't inject everybody's under eye area. I think most people are not suitable. In fact, there's 4 things I look for when I determine who's suitable, which I think is under assessed. So the quality of the skin is like a bed sheet versus a duvet. If your clothes are under the bed sheet, you're going to see them. If there's a duvet, you're not going to see them. So suitability requires skin assessment and treatment. A true hollow, the presence of an orbital bag, which makes you more of a surgical candidate, and this misnomer of pigmentation. People think that dark circles mean filler, when in fact there's a whole array of treatments, from lasers to polynucleotides. So the first thing really is assessment of what somebody really has and needs treating.
So if the skin is thin and it's not thick like a duvet, then it's not suitable for under eye filler.
Most likely not, but also you can sometimes, even if you place it at the right depth, see the filler, like a worm or a fine line, because the candidate's skin needs addressing more than the volume loss, which is a big issue because people want the quick fix. So suitability, in my opinion, is more important as well than quantity. You mentioned earlier about the volumes of filler being used and how natural it looks. 1 mil in somebody who's unsuitable can be a disaster, whereas 10 mils around the face in somebody who's suitable can be magic. It's down to suitability, and something that's not really done enough is facial assessment. They just fill to fill, and that's one example being the tear trough.
I mean, building exactly on what Zack has so well said, I think patient selection is key. As with all things, you cannot treat before diagnosis. So an appropriate holistic assessment is key. And I think when it comes to the periocular area, people age very differently. Some people get laxity in the upper eyelid. Some people get hollowing in the upper eyelid or A-frame deformity. Some people get hollowing under the eye. Some people get orbital fat herniation or orbital fat prolapse. They're not suitable or appropriate for tear trough filler. So diagnosis is number 1. And then I think, again, it comes down to ensuring that when you are using tear trough filler, you're placing it at the appropriate level. Personally, my preference is deep onto bone below the muscle in most cases. And I think when this diagnosis is missing, when people treat all patients who walk through the door the same, or when they are treating before appropriate assessment, like for example, often patients come in, they say, I've got dark circles, can I have filler under my eye? But actually they've got hyperpigmentation under the eye, which is not going to be sorted by filler. And in fact, filler could exacerbate that. That's the key, is patient selection.
Exactly. What is the best treatment from your experience? Because I know you use a lot of lasers and a lot of injectables. What is your favorite treatment for under eye? I know it, but I want you to say it.
Polynucleotides. I think, to be honest, for me, no. I would say it depends on the patient, and it depends on the reason why they have hyperpigmentation. And I like to use a combination approach. So if a patient has got thin skin, for example, then we need to improve the thickness of the dermis. And so we start with that staircase that you drew. Skincare first and foremost. You don't go to the dentist, have the teeth cleaned once, and then not brush your teeth every single day. If you want your skin to improve, you got to start with skincare at home. Number 2, and prevention, right? Number 2, we need to thicken the dermis. I like to use a combination of polynucleotides and often erbium glass laser to improve the resurfacing and the quality of the skin.
Fractional laser. Yes.
Fractional laser. And again, it depends. Is it pigmentation alone, or is it elastosis? Have they got crepiness? Crepiness, where the texture of the skin is affected, actually the best treatment is a CO2 laser, be that fractional or fully ablative.
With PRF, as we
With
were talking,
PRF.
with platelet-rich fiber.
PRF, I think, is life-changing.
Life-changing. It's totally natural and it's from your body and it has zero chemical, unlike PRP, which has the anticoagulant. It's zero chemical.
Yeah.
And we've done a lot of studies in Dow Academy on PRF in hair. And we've done an amazing study with a lot of candidates, more than 50 volunteers, on PRF versus exosomes in hair loss, on patients that are not using anything to like no minoxidil, nothing, just PRF versus exosomes. And the results are so positively forward to PRF, platelet-rich fibrin, which is cheaper than PRP and the prepared vials of exosome,
and actually more effective
and longer lasting. And I think it's revolutionary, and it's been categorized as a biostimulator in the American Academy last year. So it is such a potent biostimulator that is not widely used because I think it's not very expensive. So people like to use the expensive stuff, but it is an amazing it's an amazing potion from our own body to heal us. And I find that it works beautifully in a lot of the patients that suffer from crepiness under eye with CO2. I see drastic improvement on my mom-in-law, my grandma, a lot of people around me even. I combine, I like the doctors to combine these treatments together.
I think it's an interesting thing actually just to labor on, because there's a difference in PRP and PRF, right? PRP is platelet-rich plasma, PRF is platelet-rich fibrin. And scientific studies have proven that the growth factors last and are released a lot longer, up to day 10, whereas PRP is short-lived in terms of its release of growth factors. And again, it's autologous, it's from your own body.
Exactly.
So it's a fantastic tool, and it's an underused tool. I personally don't think PRP is very effective in the under-eye area. I think it's too short-lived and ineffective at both creating any volume and also textural improvements. PRF, however, is a game changer. Go on.
The fibrin of the PRF, it kind of gives support over time. And at the same time, this mesh of fibrin, it's like the biostimulator of calcium hydroxyapatite when you inject biostimulate with the particles being like a mesh to attract the fibroblasts to start migrating and then proliferating and producing collagen and elastin. So this fibrin mesh, which is totally natural from our own body, when placed in the under eye area, can really help compensate in a very natural and regenerative way, in a way that is really underused. And I'm trying always to push for it. And here in Dow, I think it's one of our best-selling treatments, PRF, because of the amount of studies and endorsements that Dow Academy has done for PRF. We spent more than 6 months studying PRF to maximize the platelet count from different types of separation. As a chemist, of course, preparation and centrifugation, number of spins, the type of tube, whether it's plastic or it's glass, all makes a big difference to also the durability of the PRF from it not coagulating. So we spent a lot of months researching with incredible researchers from Nawal Labs to optimize the PRF, and it's become the gold standard of Dow in all clinics. One of the things that we train all doctors in different branches of Dow in Qatar and Dubai is on the PRF. Because I find it such a magical tool. It can always be layered to any CO2 laser, erbium laser, any treatment. You combine it. It's not expensive. It's totally natural. And you can even gift it to a patient if she's doing a lot of devices and she doesn't want to pay for an injectable biostimulator. You can add it as an adjunct treatment, and it's not of high cost. It's a good push for the recovery of the patient, for the effect of the combination of all the different tools and modalities. So I find it really underrated, and I'm happy that you believe in it.
Yes, I mean, we do the P4, so we combine PRF with polynucleotides, amino acid replacement therapy, and skin boosters. And I love that combination. I think it all comes down to, honestly, when it comes to tissue integrity, it comes down to combination, because I talk about the 3 Ds of aging: degradation, deflation, and descent of the tissues. We can treat deflation with fillers. We can even treat to a certain extent descent, but degradation of the skin requires some kind of biostimulation, and this combination is incredible.
Biostimulation and regeneration, which
Yes,
is done with
exactly.
lasers.
Yes.
Because they're two different things, as I was taught by Dr. Yussra.
I would add to what she said as well there. What you've said as well is very clearly down to education of the patient.
Yeah.
Like a lot of people think filler fixes everything.
Mm.
I think injectors need to recognize their own limitations.
Definitely.
The eye being one of the biggest areas, not just the lower eye, but the upper eye. You get a lot of patients attempting Botox or filler brow lifts, but the laxity is too low.
Yeah.
Some people assume that the Botox and the filler will actually turn the shape of the eye up to more of an almond shape, when in fact what somebody really needs is something surgical,
Yes.
like an endoscopic lift, a temporal brow lift, a canthopexy, not filler or Botox.
Yeah.
Exactly.
So just like the lower eye, the upper eyelid needs a completely different approach, not just non-surgical. And that's where people get it wrong. Not knowing what can be done, lack of awareness of all these things.
And the limitation, the scope of the treatment and the limitations of the treatment.
Exactly, exactly. And just the honesty and transparency of the practitioner to really giving the real science and the real expectation of that modality. When you over promise, you disappoint the patient, because the patient did like 2 units of Botox in the lower tail and is expecting, a cat lift.
Canthopexy.
And then they go and they sometimes do thread lifts,
Yeah.
ponytail lift, which I think is horrible, which I think is totally distorting and very invasive. And actually, I feel like it disturbs the anatomy in a very harsh way that I never ever, I was just telling Yussra, we don't offer threads in DAO, neither do we do body fillers. I don't believe in those two treatments. And I always say what I don't do for my mom, Sola, I would not do and offer to my patients. And I want to know your take on threads and eyebrow thread lift for ponytail cat lift or whatever.
I think, you've got to have that weighing up of expectations and reality. Some people expect surgical results non-surgically, and they think a thread will give that to them. A lot of the times people think the thread lift looks amazing, but it drops quite a lot. It's very physiologically difficult to attach skin to skin and expect it to hold. So while it might last a long time, or initially might look good, it will drop within a few weeks. Personally, I think they're a waste of money. I don't offer threads in my practice. Non-surgically, I recognize my limitations. I'm one of those injectors that tries to stick to one thing. I think it's hard to be a jack of all trades and offer surgical, non-surgical, body fillers and not be a master of one. So my area, and I like to stick to it, is the face, particularly with the structural work, with the contouring and the balancing. Anything outside of my remit, I will refer on. By doing that, you tend to really become an expert in your field. You know what you can achieve, you know what you can't, you know who's going to get a good result, even before they walk through the door.
Exactly.
So my approach is very much, I do what I do and cross-refer to what I can't do. And that's by choice.
That's wonderful. But about body fillers, do you think it's safe?
It's been proven not to be safe. I mean, there's been deaths in the UK and across the world. And that comes down to the depth of injecting. I mean, if you inject fillers at the wrong depth below the muscle, there's always been that risk of PE or vascular involvement, embolism, which has happened around the world. I think it's off-label in parts of the UK and the US.
Definitely. It happened in Egypt with the death of many. It happened in Dubai. It happens everywhere in the world.
And it just takes a death to recognize the safety of it.
Exactly. So don't do body fillers, please, guys. Don't do body fillers.
Yeah, I mean, I completely agree with you. I think, there's limitations to what can be achieved. Even surgically, there is risk, but it's all down to candidate selection and level of experience. Body fillers will not hold.
So now I'm with Dr. Yussra and Dr. Zack, two incredible experts in aesthetic medicine. And we have concluded and agreed on two things. Threads have more risk than good to them, and their satisfaction over the long run is minimal because the threads will fall short and it's too invasive and too traumatic for your anatomy. Second is the use of body fillers. It's not safe. It has been proven to not be safe with the many deaths across the world. So please beware of these two treatments. Now let's head to one more thing. And with overfilling, do you believe that it causes the skin more laxity when you overfill it, when you fill it beyond its limit and you start seeing the filler, protruding with like the overfilled faces that I'm sure you've seen around the world. And unfortunately, in the Middle East, we have a lot of that overfilling of faces. Do you think it disturbs the laxity and integrity of the skin over the long run when you put too much filler underneath the skin?
So it's a difficult one to answer. I mean, ultimately, the answer is yes. Too much filler in short space of time, in the wrong type of candidate, eventually we know filler is going to expand. I would push it back to still say candidate selection trumps that, because if somebody is very class 2, retrognathic, volume deplete, asymmetrical, they can take filler in some areas in high volumes without that expansion effect and still look natural.
Definitely.
The issue we have is people filling the wrong type of face. If
That's
you have a round face or a square face, even a syringe split into two is going to look overfilled. Suitability trumps quantity. Technique is equally as important.
Exactly.
Yeah, I do think that overfilling can actually end up causing loss of integrity of the skin quality. And you see this particularly when, I mean, I'm thinking of a patient. I went away there for a second because I was thinking of a patient who recently came to see me, who told me she was on a subscription plan with her practitioner where she was having 20 mils every year, which is just beyond belief. And unfortunately, you can imagine what she looked like. And we encouraged her to have it taken away, but a slowly approach. But you could see when she started to dissolve it, how her skin became deflated. And you can think of an overexpanded balloon. When you deflate that balloon, what happens to the skin, right? And that's essentially what will happen if you overextend the tissues. Similar with, for example, I often say to my patients, listen, particularly when I'm doing a non-surgical rhinoplasty, there are limitations to how each nose can respond to filler, how each face can respond. And a skilled and experienced practitioner will know their limits, and they'll know how much the tissue can expand safely. And sometimes we have to say, look, this is as far as I can take you on this session. Leave it, and we need to allow the filler to integrate and the tissues to expand around this new foreign body that we've placed. Like a pregnancy, you don't go from 0 to 9 months overnight. And if you do, what happens? You stretch. So overinflating the tissues will ultimately cause some kind of, I think, damage to the tissue integrity. Unfortunately, that's my opinion, but it's anecdotal. I don't have any scientific evidence to quantify that.
Just to add to that very quickly, no one needs 20 mils. I'm shocked you
It's
said
crazy.
no one needs 20 mils every year. In fact,
Yeah.
no one really needs 20 mils per se.
Yeah.
If you're going to do a structurally imbalanced face with, let's say, 6 mils, they will not need 6 mils every year.
Yep.
Because filler placed deep onto bone doesn't move. And things that don't move typically last longer. That's why noses and cheekbones and chins can last years, macroscopically, not just microscopically. So if we're going to be doing 6, 7 mils on somebody, in about a year, they'll need 3 mils just to maintain. The issue happens when they repeat the process with the same quantity, the same approach, again and again and again. That could be a double-edged sword because practitioners will want the money sometimes and greed takes over. Patients are wowed by that initial swollen factor. So where do you draw the line? So I think the most important thing is to stage that and maintain it rather than retreat every year.
Exactly. And what we know now about fillers, you were asking, what about filler longevity? If anything, that MRI and all the MRI studies that have shown us is that filler is lasting a lot longer than we once thought. When Zack and I started, we were told fillers lasted a year, maybe 2 years. We know that that's not true. Anecdotally, I think we've known for a really long time because we see our patients on a regular basis. We see the filler is still there. Often I have patients who are flying in, their nose still looks good, and I say, so nice to see you, but you don't need anything. Off you go back again, right? And so it comes down to professional integrity, but also I think owning the fact that fillers do last longer than we think, and that's not a negative. How wonderful is that? Patients now don't need to be forking out and paying regularly for repeat treatments. They may require small tweakments or top-ups because of continuous aging and some deflation of the filler, but it's a top-up. It's not a full retreatment.
So it's good news.
It's good news. It's
when
not
placed correctly.
To me, it's not bad news.
Exactly.
However, now that we know that filler lasts a lot longer than we once thought, the responsibility of injecting it in the right place becomes even higher because that filler that you've placed is going to last for the next 8-10 years, right?
Even more, maybe.
Who knows? We'll see. Time will tell. And the importance of choosing skilled practitioner, I think, becomes even more important because the last thing you want is Tyndall effect, or superficial placements of filler lasting a decade. And I often see patients, like you said, and like I'm sure you see, with filler that is superficial, that they have become psychologically adapted to. They have become used to it. They no longer see it as abnormal, and we see it and we go, "You still have filler there."
This is very yesterday. I was at the spa and I saw a lady with migrated fillers in the mustache area, and she was telling me that she wanted to come to Dao to get injected. I told her, you need to come to Dao to get
Have it
dissolved.
dissolved.
You have filler migrated in this area. And she got used to it, as you just said right now. But I feel like one of the places that has a lot of filler migration, and we see it a lot with the mustache migration, is lip filler.
Yeah.
Is it because the practitioner injects too much filler into the lip, more than the tissue can take, so it starts migrating elsewhere because it cannot fit into the lip anatomy? Or why do you think maybe the techniques, the multiple approach, the Chinese the Russian, I'm sorry, maybe there will be Chinese lips soon, we don't know, but the Russian lips the Russian lips with the multiple multiple entry point, I feel is very traumatic for the anatomy. I don't know what your say on it is. Does it have a higher risk on migration? Please let me know what you think of Russian lips and lip filler migration.
So you're asking somebody who does very, very little lips in their practice. If you ask my team, they'll probably see that in a month, I probably would do 2 or 3 lips. And I think lips should be icing on the cake procedures, not dominate. Often they can impact other things like the mid-face and the chin and the shadows. But on the subject of migration, when people see migration in lips, particularly in areas like the lip, is because it's a very mobile area. The choice of filler is very soft and is dynamic. The more you have it, it's going to smile, it's going to move out of that compartment. We know they expand and attract water. Eventually, 9 out of 10 lips with continuous treatment will migrate within the next 5 years. So it's a dynamic area, the filler choice is soft, and there's a very small barrier between the white and the pink of the lip. It's bound to happen. That's my thoughts on it.
So it's one of the areas that you don't highly recommend unless the lips really need that hydration and that and augment correction for the deflation that has happened over time.
Absolutely. I mean,
but not as, we just want to, make our lips look Russian lips and all that, because that will get worse with time anyways because of how mobile the lip area is.
Absolutely.
By its nature.
Naturally. And even this Russian lip technique you mentioned, the technique itself may work in those with deficient, flat, dehydrated lips, but with time, even they will migrate. The issue we have is people becoming size blind and doing their lips every 2 weeks. And that's an injector responsibility.
Or 3 months, or 6 months, or
yeah, I mean, that's too frequent in my opinion.
Yeah.
It's such a
Exactly.
delicate, unforgiving area, and almost certainly impacting other parts around it. It's most likely to migrate than other parts of the face.
Exactly, and that's why we have a lot of destroyed lips. Even mine got destroyed. I was just telling Yussra, who destroyed my lips? A queen of lips in the UK. I cannot mention her name, but I flew into London to be treated by her, and I got her appointment through my mom's friend who happens to be a princess, and that's how difficult appointments were with the doctor at that time. And I had my first injection, my first lip filler with her. It went great, to be honest. I came back after 6 months wanting another treatment. I loved it. I was very young. I was 22. And then I wanted more 2 days later before going back. So I went back to her to touch up 2 days after having my fillers injected. So I had a fibrosis appear here on my upper lip and here, and it formed like asymmetry, and when I'd smile I'd have unevenness, and it didn't go away, and it stayed with me for years, and I had to dissolve it like multiple times when I opened the clinic, because that was when I was concerned with it, because before that I was too busy working and studying. And I started dissolving, and it wouldn't go away until like multiple dissolving and entry of the fibrosis area with the needle to like break it down and soften it, until it finally softened and went away. But it also made my lips very loose because of the inflation deflation trajectory of my lip treatments. And I always like to use my case as an example for a lot of patients to beware of lip treatments going wrong. I prefer, as you said, doing regenerative procedures for the lips, like lasers, erbium lasers, to rejuvenate the lip, improve the lines, PRF, which is something totally natural, and that will also help regenerate the lip area. Little fillers if needed for suitable candidates, but not to just use fillers for our lips just to make it pouty and all, because even if it looks good now, on the long run it's gonna get bad. And this is the advice of Dr. Zack and Dr. Yussra. It's not just my advice, and I'm very happy that we share the same ground on this topic.
I'm going to add a little bit to that actually. I think what happens often with the lips and actually the full face is perception drift. And people get used to, as you say, what they look like. And then the problem, particularly with lips, and I think we have to be really real about this, is social media trends. People see celebrities having lip filler or have, in the past, if you look at the trajectory of when lip filler kind of went viral, it was when Kylie Jenner opened up that she had lip filler. So the sphere of influence people are exposing themselves to or are exposed to, influences their thoughts, their behaviors, impacts their self-esteem, and that drives the wants. But myself, Dr. Zack, and most, I hope, ethical professionals and practitioners, when a patient comes in to see me and saying, can I have lip fillers? And actually, they're not ready yet to carry off a lip, right? I would look ridiculous with Kylie Jenner lips or Angelina Jolie lips. They look amazing on her face, but it wouldn't look right on my face. You cannot assess lips in isolation. And the chin is a pedestal upon which the lips rest. And too often we see overfilled lips, people thinking that they have to have more, even if it's little, but often you don't. And then understanding that this area is hypermobile, it's a concentric muscle, it's constantly moving when we're speaking, when we're smiling, when we're eating. That contraction of the muscle is going to increase the risk of migration. And then to me, and I mean no offense to this, but stupid trends like Russian lips, I totally am against these trends because I think they are problematic. The way that they are injected predisposed to migration because you're going through the vermilion border frequently. It's the same with the eye area. It's a very small area. It's an area that is complex. It's an unforgiving area. The skin is often thin. The muscle is concentric. These areas of hypermobility, you've got to be careful. But yes, that I think has I think contributed to the problems that we've seen. And too often, in fact, every single day I look around me and I think, oh God, this poor lady has migration and she's used to it. She's not aware of it anymore. And people don't see themselves in 3D. They see a 2D image of themselves, a photo, they see themselves in the mirror. Often you need to take photos or see yourself on the side or listen to the people who are around you, who are advising you. If you have had lip filler that has migrated, my advice is start fresh, get it out and start fresh.
Exactly. And work on the tissue. So to finalize, practitioners, beware of unforgiving areas. Be very careful in selecting your patients when it has to do with around the eye and the lip area because it's very mobile. The tissue is very delicate. The skin around the eye is very soft. You have to be very selective with your candidates. And patients also beware of overtreatment in these areas and be careful. Be careful. Thank you so much.